So today we'll talk about mesentery. So what is mesentery? It is the double layer fold. It is a double layer fold, number 1 point. Number 2nd point, it fold of the peritoneum. And number 3rd point, it suspends only the small intestine. It suspends only the small intestine from the posterior abdominal wall. Organ is being suspended. If it is like this, we have the organ over here. This is the visceral. This is the parietal peritoneum. And this is actually in this way. This will hence this organ from the posterior abdominal wall. If this is posterior one, this is anterior one. It will hang, and this sort of structure from here to where, this will be known as the mesentery. It has got two margins. One is called the attached border or the root, and second one is the free or the intestinal border. It is in the free border. It will enclose the either jejunum or the ileum. So if you go like this, this is the mesentery we have over here. Have organ over here. Parietal peritoneum. This is the posterior abdominal wall. Here we have got all the structures which are coming through this one, and this is the mesentery. This one is the mesentery. This portion will be known as the mesentery. Number 1. Second, this posteriorly we have got this posterior root. This is the fixed one. Posteriorly we have got the fixed portion, and this portion, this one is the free portion. This one is the free portion. This is the free one. This will be considered as the free one, and this one with the posterior. This is fixed, and here we have got the blood vessels which are going reaching up to the organ, and this portion is known as the mesentery. So now length of the mesentery. Its length is about root. It has about 15 centimeter or 6 inches, and its free border is 6 meter. Its free border is approximately 6 meter. The root of the mesentery, talk about attached to the it is attached to the margin of the mesentery. It is attached to the posterior abdominal wall along the length of 15 centimeter. You can see over there. So we have got the is 15 centimeter in length. This is the duodenojejunal flexor. From here, it is coming like this, and it is coming up to the ileocecal junction. Right side. This is left. So we have got this length. This much length is 15 centimeter. This much length is 15 centimeter. This is the 15 centimeter length from the duodenojejunal flexor to the ileocecal junction. This is the root of the mesentery. Extend from the duodenojejunal flexor at the level of the L2 vertebra to the upper part of the sacroiliac joint. This portion here at the right side, here we will get the right SI joint. Here you will get the right, at this level we will get the right sacroiliac joint, and at this level we have the L2 vertebra. We have got the L2 vertebra. At this level we have got the L2 vertebra. Now the structures crossed by the root of the Now, what are the structure? This is the root attaching on the posterior wall. So there are many structures which will be crossed by this root. And what are the structure which lie posteriorly? So we are seeing the duodenum is over here. So it will cross the duodenum first. Then what we are seeing, the abdominal aorta, or right over here. So it will cross the abdominal aorta. It will cross the inferior vena cava. Of course, it will cross the inferior vena cava. You can see of the inferior vena cava over here. This is the inferior vena cava. So it will cross the inferior vena cava, of course. Inferior vena cava. Then it will cross the right ureter. We have got the ureter over here. So this is the ureter. This is the ureter. It will cross the ureter also. It will cross the ureter also. It will cross the ureter, and it will cross, of course, the right psoas muscle. It will cross the right psoas muscles. So these are the 5 structures which will be crossed by the root of the mesentery. And what are those? The duodenum, abdominal aorta, inferior vena cava, right ureter, and the right psoas muscle. And this is the MCQ question which is being asked, that what are the structure which is being crossed by the root of the mesentery. So answer is duodenum, number 1. You can see the duodenum over here. Then we have got the aorta over here. Then we have got the inferior vena cava over here. Then we have got the ureter over here. We have got the psoas muscle over here. So they are the 5 structure which is being crossed by the root of the mesentery. Now next we have got the free border. Now free border. So free border which will include the duodenum, jejunum, and the ileum, which is 6 meters in length, and it will include the jejunum and the ileum. So what are the content of the mesentery? What it will contain? So contents are in the free border, jejunum and the ileum, and the jejunum and the iliac branches of the superior mesenteric artery and accompanying veins through the mesentery. This is the this one will be the free border. This will contain the organ, jejunum and the ileum. This is the free border. This will contain the jejunum or the ileum. And through this here, there will be the blood vessels which will be passed. The artery will be passed, the vein will be passed, and the lymphatics will be there. So at this point, we will get the superior mesenteric artery and the veins, the lymphatics, which is known as the lacteals over here, and the mesenteric lymph node, which are 100 to 200 in number. We'll get the fat and the autonomic nervous system. So this structure, this will contains the jejunum or the ileum, of course, and through the mesentery, the artery, that is the superior mesenteric artery, and accompanying veins. Then we have got the lymphatics. Then we have got the fat and connective tissue and the autonomic nervous system. Finally, if you revise the mesentery, so it is a fan-shaped fold of the peritoneum which suspends the jejunum and ileum from the posterior abdominal wall. Its root is 15 centimeter and free border is 6 meter. And the root of the mesentery attached relations are duodenum, aorta, inferior vena cava, right ureter, right psoas muscle. It extends from the dendrojejunal flexure, that is at the L2 level, to the right sacroiliac joint, and its contents are the jejunum and ileum, of course, the superior mesenteric vessels, the lacteals, lymph node, fat, and the autonomic nervous system. Now we'll talk about the mesoappendix. So mesoappendix is, as the name suggests, it is the fold of the peritoneum which hangs the appendix. So it is a small triangular double layer fold of the peritoneum. If it is either it is mesentery, mesocolon, or mesoappendix, it must be a double layer fold. Then only it could suspend any structure. So it is a double fold of the peritoneum which suspend the vermiform appendix from the posterior surface of the lower end of the mesentery close to the ileocecal junction. Suspend the from the posterior surface of the lower end of the mesentery close to the ileocecal junction. You see the ileocecal junction over here. We have got the ileum over here. This is the ileum. This is the ileum. And this is the cecum. This is the ascending colon. So we have got the cecum over here. This is the cecum. This one is the cecum. So ileocecal junction, at this ileocecal junction, it will be hang. So it will contain what it will contain. This is the iliac region. This is the ileum which is being closed over here, coming to the cecal region. So this one, and here is the ileocecal fold. This is the ileocecal fold. The ileocecal fold of the peritoneum, and it will get cane like this, and it will enclose the for appendix. What are the contents? It will have the appendicular artery and the vein and autonomic nerves and the lymphatics from the appendix. So they are the content of the this major appendix. So it is from the ileum over here. We have got the cecum over here. At this ileocecal junction, the fold of the peritoneum will hang the appendix. Then we come to the transverse mesocolon. Transverse mesocolon, as the name suggests, what it will do, it will suspend the transverse colon. The name suggests to suspend the transverse colon. So it is a fold of the peritoneum that suspend the transverse colon from the posterior abdominal wall. This will also suspend the, like the mesentery, this mesocolon will also suspend the transverse colon from the posterior abdominal wall. Next, we have got the parts. The transverse mesocolon has following parts. It has two border and two surfaces, anterior border and posterior border, and surfaces are anterosuperior and posterior inferior. Has got anterosuperior and posterior inferior border. So this is the root of the transverse mesocolon. This is the right transverse colon, and this one is the left side of the left end of the transverse colon. We have got the head of the pancreas over here. This is the body of the pancreas, and this is the root of the transverse mesocolon. Root of the transverse mesocolon. Anterior border. The anterior border. This anterior border is attached to the posterior surface of the transverse colon. So this one is the transverse colon. Here you have got a transverse colon. If you will combine this, this will become the transverse colon over here. So its root is attached to the posterior surface of the transverse mesocolon. Posterior surface will attach. This one is the, if this one is the transverse colon, so the root will be attached posterior to this one. It will attach to the posterior to the this one. So if this is anterior, this is posterior. Will be attached over here. Attached over here. This is the posterior one, and the root will be attached over here. So it will attach, and the posterior border is attached to the anterior border of the body and anterior surface of the head of the pancreas. And its posterior border is close to the pancreas. Here we have got the pancreas over here. So it will be attached to the anterior border of the body and anterior surface of the head of the pancreas. So this is the head of the pancreas over here. We have got the pancreas in the, this is the duodenum. We have got the pancreas over here. It will attach to the anterior border. It will attach to the anterior border and the head of the pancreas. Content, as the name suggests, it will contain the transverse colon and anastomosis between the middle colic and the ascending branch of the left colic vessels. So it will contain two important structures. One is the transverse colon, as the name suggests, and it will also contain the anastomosis between the middle colic and the ascending branch of the left colic vessels, and autonomic nervous system, of course, and the lymphatics and connective tissues. So, and anterior border is attached to the posterior surface of the, we are from the behind. We have got the transverse colon over here. The liver, then we have got the stomach over here, You have got the transverse colon over here. It is coming like this one, this, like this. You have got the liver over here. Then we have got the stomach, and we have got transverse colon over here. We have got the pancreas over here, and we have got the duodenum over here. Duodenum. Stomach, and we have got the transverse colon over here. We have got the pancreas over here. We have got the pancreas over here. Talking about the transverse, so this is the gateromentum. This is the gateromentum. Here we have got the lesser omentum. It will come like this. It's coming like this, and it will this. Reaches up to the pancreas. It reaches up to the pancreas over here. So this is the transverse colon. The posterior one, and this is the anterior one. This is the anterior one. We have got the transverse mesocolon over here. The transverse mesocolon is being completed by it is being completed by the lesser omentum. It is being completed by the lesser omentum over here. So it is like this. Like this. So this portion over here. This one is the transverse mesocolon. This portion is the transverse mesocolon. This portion is only the transverse mesocolon. So anterior border is attached to the posterior part of the transverse mesocolon, and this posterior border is attached to the root and the body of the pancreas. So you see this one? Here we have the pancreas over here. So it is attached, posterior border is attached to the root, and the here we have got the pancreas. So it will attach to the anterior border, the anterior border, attached to the anterior border, and the head of the pancreas, So posterior border, anterior body attached to the posterior part of the transverse mesocolon. So they are attached to the posterior surface of the transverse colon, and posterior body is attached to the anterior border and the anterior surface of the head of the pancreas. Now next we have got the sigmoid mesocolon. The sigmoid mesocolon, as the name suggests, it will include the sigmoid colon only. So sigmoid colon is the triangular fold of the peritoneum that suspends the sigmoid colon from the posterior wall of the pelvic cavity. It will hang the sigmoid colon from the posterior wall. It will hang there. So we have got the sigmoid colon over here. We have got the sigmoid colon over here. This one is the sigmoid colon, and here we have got the rectum over here. We have got the rectum over here. Sigmoid colon. The descending colon, this is the sigmoid colon. And see the mesentery over here. See the mesentery over here. It is being suspended like this. Parietal peritoneum. Then we have got the parietal peritoneum over here. This is the parietal peritoneum. Then we have got the parietal peritoneum. So it is a triangular fold of the peritoneum that suspends the sigmoid colon from the posterior wall of the pelvic cavity. We hang from the posterior wall of the pelvic cavity. We are on the posterior side. We go over here. We have got the posterior. This is the superior one. Of course, this is the inferior one. We have got the right side over here. We have got the left side over here. But this structure, the sigmoid colon, the common iliac artery and the superior artery, the ureter which you are seeing, this is all the posterior one. This is all the posterior one. So attachment, the root of the sigmoid colon is an inverted V shape. It's an inverted V shape that has got apex, left limb, and the right limb. It has got, it will go like this. It will go like this, and it has got an inverted V shape structure. So it will become the apex. This is the right, and this is left. It will become the right and left. In the apex, it lie over the ureter. The apex will be lie over the left ureter at the termination of the left common iliac artery. The apex will lie. This is the apex. This is the ureter over here. This is the ureter over here. This is the ureter, and apex is lying over here. Apex is lying over here, and at the level of the termination of the common iliac artery. This is the common iliac artery. It is terminated over here. It is being terminated at this level. It is terminated at this level, and you can see that this apex, its apex is lying over here. Regarding its right limb, it has to the posterior wall of the sacrum, pelvic wall of the sacrum, extend from the left sacroiliac joint to the S3 vertebra up to the midline. And the left limb attached to the upper half of the external iliac artery. You see in the next diagram. See over here. This is the inverted V-shaped structure. This is the inverted V-shaped structure. This is the ureter. We have got the ureter over here. This is the ureter over here. The ureter. This is the and apex. You can see the apex over here, lying at the ureter, just at the termination of. This is the common iliac artery. This is the common iliac artery. This one is the common iliac artery, now terminating into the external and internal iliac artery. So, this common iliac artery terminating into the right and left. This is the external iliac artery, and you have got the internal iliac artery. So, at this level, its apex lies. And what about its left limb? See the left limb, it is extending along the external iliac artery, extending along the external iliac artery. And the left limb extends from the S1 to the S3 vertebra, from the sacroiliac joint to the S3 vertebra. So this is the inverted V-shaped structure. This is the inverted V-shaped structure. The right limb is following the external iliac artery. This is the external iliac artery. The apex lying at the level of ureter, where the common iliac artery bifurcate into the external and internal iliac artery. And the left limb is from the sacroiliac joint to the S3 vertebra. So what about the contents? As the name says, everywhere we will see the sigmoid, the content of, as the name suggests, since it is sigmoid major colon, so sigmoid colon will be there, and sigmoid branch of the inferior mesenteric vessels will be there. Sigmoidal branch of inferior mesenteric vessels will be there. Then there will be the branches of the superior rectal vessels and the lymphatics and the lymph node, fat, and the connective tissue. These will be the content of the sigmoid major colon. Now, finally, we are coming to the peritoneal ligaments. There are few ligaments over there. So we have got one, the falciform ligament, which is a sickle-shaped fold of the double layer of peritoneum that connects the liver to the diaphragm, which we have already read that it will connect the liver to the diaphragm. When we divided this abdominal organ, we have got the stomach over here, so liver is over here. This is the anterior and this is posterior. So this is the ventral mesogastrium, this is dorsal mesogastrium. Structure over here, this is the which developed, this is the falciform ligament. This is the falciform ligament which connects the liver to the anterior abdominal wall. It has got free margin, and it has got attached margin. It has got free margin and attached margin. The free margin extends from the umbilicus to the inferior border of the liver and contain the ligamentum teres hepatis. And it will contain the ligamentum teres hepatis. And the attached margin connects the anterior surface of the liver to the diaphragm and anterior abdominal wall. So this will contain the liver to the, we have diaphragm over here, to connect the liver and the anterior abdominal wall. But this free margin, it has got attached margin and the free margin. So attached margin will attach to the, we have a liver, anterior abdominal wall, and the diaphragm, of course, the diaphragm. You can also connect diaphragm. But the free margin, attached margin, you have got attached margin over here. Attached margin, so you have got the anterior abdominal wall, we have got liver over here, we have got a diaphragm also over here. And they just reverse this one. And so it will connect like this, all the structure, but the free margin of the ligamentum, falciform ligament, the free margin will have the will contain the ligamentum teres, which contains are the ligamentum teres hepatis along the P margin, paraumbilical veins and accessory portal system of the which connect the paraumbilical vein to the diaphragmatic vein. These will be there. They are will be the content of the peritoneal ligament, that is the falciform ligament. See over here that this one is the, here we have got a diaphragm over here. This is the right side. This is left corner section. We have got the liver over here. Liver over here. And you have got a diaphragm over here. This is the diaphragm. This one is the diaphragm. This one is the diaphragm. This is the diaphragm. There. See, here we have got the diaphragm over here. This is the diaphragm. Diaphragm over here. This is diaphragm. This is right lobe of liver. This left lobe of liver. We have got the stomach over here. Now this is the attached. This is the ligamentum teres in the falciform ligament. We have got the falciform ligament over here. So this in this falciform ligament, this attached margin is attached to the liver, and the anterior-abdominal wall, attached to the liver and anterior-abdominal wall. But this free margin will contain the ligamentum teres. Free margin will contain the ligamentum teres. So, talking about the level of the liver with the diaphragm. So, this is the liver. The inferior vena cava. Here we have got the umbilicus. Here we have got the anterior-abdominal wall, and here is the falciform ligament. This is the falciform ligament. This is actually the falciform ligament. So we can see the ligament. What does it do? Attached to the diaphragm. Attaching to the diaphragm also. This portion is the falciform ligament. This is the falciform ligament. This one is the falciform ligament, attaching itself to the diaphragm, attaching to the umbilicus also, and this P margin. This portion, ये वाला जो portion है, this portion is the P margin, and in this P margin it contains the ligamentum teres. This P margin it contains the ligamentum. This anterior, the attached border attached to the liver, attached to the diaphragm, attached to the anterior wall, umbilicus, but this P margin will contain the ligamentum teres hepatis. The other ligaments, we have got the coronary ligament, then the right triangular ligament, and the left triangular ligament. So the coronary ligament, which connects the liver with the undersurface of the diaphragm, and connects the liver to the kidney also, that hepatorenal ligament. Right triangular ligament connect the right surface of the liver to the diaphragm, and the left will connect the left lobe up to the diaphragm. Thank you. I thanks Yogesh Sundake sir for all sorts of the content. Thank you.